Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, everybody. Welcome to another great episode. Today's going to be a very exciting conversation. A conversation that leads a lot into what I do. And I am so grateful and thankful that I have somebody who is doing that in her own life and also has a professional backing. So today we have a person who has worked as a consultant, speaker, writer. Our expertise spans the field of healthcare management, patient-physician consultant. Hi, Dana Sherwin. How are you?
Hi, so wonderful to be here and have this conversation with you. I appreciate this opportunity.
I am so happy to have you here. So we are going to have a very long conversation, a very thought-provoking conversation that covers a lot of things. But, please just tell our audience who you are, how you got to where you are, and the work that you do today.
Okay. My father was in the healthcare insurance field. And when I was 16 years old, he introduced me to possibilities for professions. And he brought home 3 brochures. One was to be a human resource executive. One was to be a dietitian. And the third one said hospital administrator. Mm-hmm. And I thought, hospital administrator, that's interesting. I enjoy managing people and managing organizations, but yet I want to do something important with my life. So maybe management and healthcare, that's the way to go. Right. So clearly, I had a lot of positive influence in my life in order to be directed into healthcare. But I knew that I wasn't really, I didn't really take to being a doctor or a nurse or a psychologist doing direct patient care. But I really liked working with people and liked moving things in the right direction and doing something that was very socially valuable. So I went to Cornell University, and then I went directly to what at that time was one of the best programs in healthcare administration at the University of Michigan. And that's really where my career in healthcare really started in graduate school.
So healthcare management, to the average everyday person who may not know what that entails, is there like a specific area of healthcare that, in your case, that attracted you, or were you just intrigued by, the whole healthcare system as a whole?
Right. I guess growing up in New York and really having a good feel for a very diverse population, both, race and ethnicity. My background is from a family of immigrants, and just sort of growing up in the outskirts of a major urban area, I just felt very drawn to doing what I could do to help all populations get the best healthcare they could get. I actually grew up, aside from my father being in the health insurance industry, I grew up behind a hospital and a jail. And so it was one or the other. So understanding that I wanted to contribute in a way that I thought was very aligned with, my own attributes and my own personality, and enjoying working with people, but like building systems to make things go better. So generally, hospital administration, healthcare administration has a lot of components of the whole field of management and the advanced practices in management. And I always looked outside of healthcare to see what I could bring in to, at first, it was about running hospitals and operating hospitals, and what could we do better to make hospitals more effective, efficient, and also to be able to create like a good patient experience for people so they could get the care that they need. So that's really why I was drawn to healthcare management.
Okay. And was it everything you expected?
Well, things are always much more complicated and complex than one expects. Right. And I must say, it's a very challenging industry, and it also afforded me a lot of different opportunities. So I did work in hospitals. I worked for Hospital Association. I worked for consulting firms. I even did a temporary management position at a very large foster care agency. And then I moved and had an opportunity to help build a Medicaid managed care company.
Great.
So I got to see that side of the healthcare system as well. So really it afforded me a very, diverse and interesting career.
So that's really beautiful to hear, and you did make your impact. But in healthcare, we still have some work to do, and we are still doing that work with folks like you who dedicated themselves to the career, and also on the receiving end of the healthcare. It really kind of like brings things to light, when you actually have that experience, which is something that we're going to delve into. So, what has your experience been as, I would say, a recipient of, what the healthcare system has to offer?
Yeah, so let's define it. Patient.
Right.
So I was diagnosed with a chronic illness, a blood disorder, about 20 years ago. And it was discovered only because I had a blood clot
Mm.
that was bothering me. And I had diagnostic evaluation to figure out why I had the blood clot. And it was determined that I had this genetic disorder in my bone marrow. Very sort of a rare disease. And I then came under the care of doctors. However, it was the type of chronic illness that at the early stages, you're able to still work and lead a normal life. It really just needs to be monitored. So for many years, my disease was just monitored, but it all introduced me to the whole field of hematology because it was a blood cancer disorder and I needed to be watched pretty closely. And this was all fine in terms of leading a fairly normal life and having 2 children and working a full-time job and doing things that were interesting to me. And then my health crashed and I needed more attention. And the only cure for my disease was a stem cell transplant. And at that time, and we are talking probably about 10 to 15 years ago, that the statistics were not good on stem cell transplants. What some of the older studies showed that maybe there was a 30% survival rate. And at that time, I was still feeling okay. And I just was really scared about what would happen if I wasn't part of that 30%. Like it was very daunting. And so I continued on until actually my health crashed and I had no choice but to get a stem cell transplant. And I was fortunate that the timing worked out because if I waited any longer, I probably wouldn't have been a candidate because I would have been too sick. So I got very lucky. The system found a donor for me. Usually you can get donors from either your children or your siblings. And I had my siblings check and my siblings matched each other, but they didn't match me. But the International Bone Marrow Blood Bank, it used to be called now it's called the National Marrow Donor Program. And it's not really that well known, but I think it's getting more and more known, and more people make contributions. But they did find a match for me, and they found like a perfect match. It's a 10 out of 10. They found a perfect match. And what was interesting is that this person had joined the registry when this person was 22 years old. And it was 7 years later that this person was called upon to say, 1, are you still interested in donating? 2, can you please, she said yes. 2, please take all the requisite medical evaluations to see if you're still of meeting donor requirements. And I was also fortunate that this person lived on the East Coast, so made the transportation of the blood go very smoothly. So all of that was in my favor. And with the process they needed for me, I was in the hospital for 5 weeks. The whole transfusion of the stem cells took 20 minutes. It was sort of incredible and amazing. But I needed to be monitored very closely, and I needed a lot of red cells and white cells and platelets while I was in the hospital recovering. But I did get to go home after 5 weeks and started my recovery. And then 6 months later, I came down with a very bad case of pneumonia. It was January 2020. And if you recall what happened in March of 2020,
Everything shut down.
everything shut down. So I didn't really have any access to care like on a physical basis because hospitals were only seeing people on an emergency basis. Everything else were virtual visits. But my recovery allowed me to, it was okay. I got better. And once things opened up, I started seeing doctors regularly. So for me, once I started feeling better, like that first year, I mean, and I had many hospitalizations and ER visits and other things to address my issues. But my recovery involved seeing like 15 different specialists, medical specialists. And it dawned on me that I needed a good way to track and coordinate all of my care. I had the brain power, but I didn't have the emotional or the organizational focus yet. So when I started thinking about it and starting to figure out what I needed to do now that I was recovering, and I was able to do pretty much everything but some physical things. I had great supportive family. I had a nice home to live in and help, and just I was able to have all the best things for my recovery. But I really wanted to do my medication management myself, my care management. I thought that would help me through my process by really focusing on taking care of myself and seeing like 15 different specialists and getting pneumonia and having to recover from the pneumonia and having some cardiac issues and having to recover from the cardiac issues. I needed a very strong pathway to help me through this. So I started thinking a lot about it and talked to a lot of my doctors about it, and also started doing research on how to enhance one's communication with doctors, how to enhance one's own learning about your own health condition, how to manage your own care, how to ask questions, how to do research. And I did a lot. There are researchers over the past like 40 years that have been studying these issues, but this is not easily accessible to people. So I started putting things together and I started developing resources and writing about it. I post a lot on LinkedIn about it and writing about it, and also developed a workshop presentation to help people with some of the things that I struggled with and how I organized myself and how I thought about my own care and helping myself.
Right.
And that's really where I came up with sort of my body of work, which I call the thinking patient.
That's beautiful. The thinking patient is basically, that is beautiful. That term is basically thinking outside of what is going on, because we're humans, we hyperfocus what is priority at the moment. And this is reflected in us as patients, also as providers, healthcare providers. We hyper-focus on, things sometimes that we don't see everything. So that is why there's a whole patient-centered approach, treating the whole patient, and all of these recent phenomenon that we are pulling into, even social determinants of health, outside of what is going on with this patient right in front of me. What else? How else can we help? How else can we help this person stay on track and organize? And thinking patient is something that I know a lot of providers and patients are like real benefit from. So something that you said in the beginning that I just want to go back to just a smidge. You got diagnosed with a genetic disorder, right? That I'm pretty sure you were not aware you were predisposed to this. Would that be true?
Yes. In fact, it's not inherited. So it means it wouldn't have necessarily showed up in any other family member.
Okay.
But the only genetic test that I had up until that point was for breast cancer, the breast cancer gene, because my mother passed away from breast cancer and her sister did too. So I was considered high risk.
Right.
And my sister and I were both negative for breast cancer. And also a year after my diagnosis, the medical and research industry came up with the test. It's called the JAK2 gene. So when I was diagnosed, there wasn't even a genetic test for the disease. As you know, as things evolve, I mean, I owe my life to medical advancements, because even the stem cell transplant that I had was much better than the one I would have had from 10 years prior. So that's the thing. I had symptoms throughout my life. I had symptoms as a teenager. I had symptoms in my 20s, and I didn't really complain about them. And I just sort of let it go. And I didn't even really want to know when I was in my 20s and 30s if there was anything really seriously wrong with me. And they were things like because I had too much blood in my body, I'd get very bad headaches during my menstrual period. I had very bad achiness. And also, I had a lot of pruritus, the itchiness when you come out of a shower. So they were I have sort of a thick skin and I sort of like put my head in the sand. But even some other doctors, they could have said, I think something's wrong. Maybe we should evaluate it more. And nobody did, and I didn't. And that's one of the things I will always say, that I wish I would have done things differently when I was even in my 30s and 40s. I was diagnosed at, I think, 47 or 48. So I would have done things differently. And part of it is me, putting this work together to share with other people that you don't wait till the last minute. You take care of your health. You have a primary care doctor. You see a doctor once a year. You share everything, that's going on with you with your doctor, so your doctor could figure out, maybe there's a link between drinking a lot of coffee and then not drinking coffee and then getting headaches, or you used to smoke a lot, or you're not eating that healthy, or you're drinking too much, or you're having too much sugar in your diet. Whatever it is, these are important things. I mean, people spend so much time picking out a car to buy. People spend time learning, how to play chess or to make a recipe. People are very detailed. So my thesis is, let's be detailed and care as much about our own health. I mean, as I said, I am guilty of putting my head in the sand. And that's why I feel like I am really now like compelled to share with people. And certainly the people around me, they hear it enough. So there's no preaching going, because they hear it from me, my young adult children know they need to see a primary care doctor every year, and know they need to see a dermatologist, because we've all had skin cancers and we need to keep track of all that. And it's really important. But I think when you're younger, you take your health for granted so much. And then when you're older, you don't want to know. You don't want to know if something's really wrong with you. I mean, there are, some people who really do take care of their health really well throughout their life. And sometimes it's out of your control, and you can't, and medical advancements can't possibly fix certain things.
Right.
And maybe they will in the future, or maybe if you catch it early enough, you can reverse what's going on. But yeah, when I look back, it was a scary time. It wasn't scary going through it because I didn't know what the result was going to be.
Right. So the most important part that, something that you said that jumped out at me, everything that you said was very important, is you did not say anything to the doctors, and the doctors did not inquire further. The doctors, your nurses, your social workers, your case managers, your physical therapists, your speech language pathology, occupational therapists, the whole gamut of the healthcare system depends on you. Depends on you, the patient, to say something so that we can follow up and find out what is really going on, right? So there's an expectation of you're the specialist or you're the whatever. Like, if you don't say something, there is no follow through or digging that happens. And unfortunately, things go undetected until whenever. So let's talk about the thinking patient. I absolutely love it. So what is a thinking patient? What does it cover? What is it about? What message are you trying to send to everybody?
Okay, so I wanted to, because being sick is stressful, because being sick, it's the uncertainty about what the future is going to be, that how hard sometimes understanding a medical condition is, or the terminology or medications. And it's a very emotional experience being sick. Maybe it isn't for other people, but certainly when you have a chronic illness, I think if you don't have some emotional experience related to, even if you're pre-diabetic, I mean, I remember my mother was overweight and the doctor really scared her and said, you need to lose this weight or else you're going to become a diabetic. And boy, did she go into action. So I think there was some being scared in that sort of normal pathway when people tend to be a little overweight and what could be. And she got scared. So the part of my trying to figure out how to create a reliable, sort of easy to understand structure for people to move forward in this emotional, anxious, stressful, whatever it is, or even if it's minor stress, having a pathway to move forward, you could still be stressed. But when you have a pathway to move forward, you're doing something very productive and useful for yourself. And it's also like one foot in front of the other, making small strides really add up. I'm a very big believer in one little step at a time, get you to the next place, get you to the next place. And so the structure that I created was sort of recognizing all of the sort of the strategies and the thought process that goes into one, preparing for an appointment with a doctor. Because as we all know, doctor's appointments are between 15 and 20 minutes if you're lucky. Maybe if your doctor is very thorough on an annual examination, you will get 45 minutes. But some people have told me they don't get 45 minutes for an annual evaluation.
That's very rare. 45 is rare.
Right. So there's that pressure of the time period, not just for the patient to say everything they want to say, but for the doctor too.
Absolutely.
And the doctor's feeling that stress too. But as you mentioned, there's certain responsibilities that a patient needs to hold themselves. And you can't always rely on a doctor or the healthcare system to navigate it. You need to be sort of engaged. So part of it, I call it, really part one. There are 5 parts, and part one is preparation. You go into a doctor's appointment, then you should be prepared. What are the questions you want to ask the doctor? What do you want to tell the doctor about what has happened to you in the recent past? Maybe you haven't met the doctor before. You want to prepare a short summary of your health history and maybe some of the tests, or bring your, if it's on your mobile phone, to show him, what previously has been done, to be very sort of prepared with a very succinct summary of what your history has been. So knowing what your priorities are for the appointment, what questions you have to ask, the more you write them down, the easier it will be to have that discussion flow better. So when the doctor's giving you answers to your questions or raising other issues, you can raise new questions or explore issues you don't understand that the doctor's telling you, and not have to worry, what am I going to forget from what I wanted to ask the doctor originally? So it's very important to know what your priorities are when you walk into the meeting. I call it a meeting because my whole management background, I sometimes use business terms, but when you walk into that appointment, you have that list of things. And also, if the doctor explains something and you don't understand it, and you ask them to explain it again, and they do, you still don't really understand it, you make a note to yourself, and when I get home, I'm going to do a little more research. I'm going to learn a little bit more about that drug or that procedure, right? And then also if the doctor says, I'd like you to follow up with this doctor or for this test, or in 2 months, I want you to get your blood taken again. Well, you're in charge of you. You need to keep track of all this. And writing it all down just helps you participate. And we're going to get to participation in a bit, helps you participate in this exchange. Because as you mentioned, so important, let the doctor get to know you. A very large percentage, there have been studies, but a large percentage of people withhold information from their doctors. And for all kinds of reasons, and whether it's the use of drugs, smoking, alcohol, sexual activities, lifestyle activities, or how about I haven't seen a doctor in 10 years?
How about I'm using holistic supplement? How about I'm using St. John's Wort? St. John's Wort interacts with a lot of medicine, right? Mm-hmm. So yes. I think it's intimidation and also fear of judgment. Because as a society, we're not void of not being judgmental. And as much as I know most medical practitioners don't lead with wanting to be judgmental. There's certain verbiage or certain things that we say that, may just, fracture that relationship a little bit. So you're right. A lot of people are not forthcoming because of what they're concerned or how they're concerned about being seen.
Exactly. So sometimes you have to just, if you're meeting a doctor for the first time, people tend to be a little bit more, some people tend to be reserved, some people to be really out there in terms of, see me. And I think, you need to find like what that balance is. But I think
Right.
because it's a limited appointment time, you can't be that shy. You have to be able to say, I wanted to make sure we talk about this. And if you don't, and I've explored this, and when I do presentations on this, people will raise this question. Well, what if there are questions that I haven't gotten to? Like, it's just the time went by so quickly and there were other questions on my list I didn't get to. Then I say to people, then ask the doctor, how can I communicate? Doctor, I didn't cover all my questions. How can I communicate with you so I don't have to wait till the next appointment? And do you do email, text, through the portal, patient portal? How do you like to communicate? I have 15 doctors. They communicate in 15 different ways. It's real. So there's no even theme to all the doctors that work in one practice together.
Right.
But I think that's important to know how, if something comes up, and to know from that doctor, if it's the first time you're meeting, like it's something like I will always ask a doctor if I'm meeting them the first time, and then I will make the note how they like to communicate. So if something comes up, I think of something, I don't have to wait. And I'm not just Googling it by myself because sometimes I'm wrong. I really am relying on the doctor, but I have a role to play too, because it's important to understand.
Right. In your experience, have you seen that organizing, your questions ahead of time and also doing your due diligence, for lack of a better way to really phrase it, that has actually, in a sense, strengthened your relationship with the various doctors that you see, asking to communicate your questions and also your concern? Have you seen that although they may not have that much time to spend with you at an appointment, that there is room to further explain something or answer your question?
Absolutely. I have received such enthusiasm back from doctors. They really appreciate it when I come prepared, and I keep my notebook. Whatever notebook you use, it's important to put it in a written format. And they see that I'm prepared and then I have the list, and they just respond very enthusiastically to me, because I do appreciate that they have a very difficult job to do. They have to get to know me. They have to try to figure it out, because that's their job, to figure out, what's wrong, or how to help me recover, or how to help a person address their issue. So I have a great appreciation for doctors. But you also, in knowing all this, you're more sensitive to if a doctor's not responding to you in the way that maybe you thought the doctor should respond to you. And this has come up in some of my sessions with, so I would say older adults, because older adults seem to be more, and I don't know if you've found this in your practice, I think older adults have gone through a lot, and whether they're prepared or not, they usually have a lot of questions for the doctor. And sometimes they even come in with a whole file. Here, doctor, I did this research. And doctor does not take well to that, because it's not how sort of they work. If you say, oh, I did research, and you're summarizing the research, what do you think about that? That's a much more visit-friendly and relationship-friendly way to ask a question about some study. Oh, doctor, have you seen this study? Oh, would you like me to send you a copy of the study? Doctor can't possibly know everything that's, going on. So my response to a couple of people who asked me, well, doctor doesn't respond too well to me when I'm coming at them with all this stuff, I say, and they start saying, well, who's the doctor here? Did you go to medical school? And, the person is really put off by the doctor's attitude back to them, because some doctors they'll just say, oh, Mr. So-and, please just hold up for a minute. Let's go through things one at a time. Some doctors will do that. Other doctors will get snippy. And if a doctor gets snippy, you say to the doctor, I didn't mean any disrespect. I'm just not understanding like how best to communicate with you. Possibly can you communicate with me so that I'll understand how to present information to you? But sometimes it's up to the patient to slow it down, right? Because you want the doctor to get to know you.
Right.
You want to be respectful of the doctor. You're hoping the doctor's going to show you that same respect.
Right.
But I think if you show the doctor in a very diplomatic way, look, I've done all this work. Help me figure out how to explain this to you or how you can give me the best feedback.
Yeah. Yeah. It's that saying is not what you say, is how you say it. Right. And people have to recognize that. Most of us spend time in studies. We've had experiences. We've seen different disease processes. We also recognize that everybody is different. However, if this is the one thing with Google, right? Google has a gamut of information, including evidence-based resources, right? And the opinion-based stuff, right? So sometimes it can be information overload, and it can be hard to decipher what is what. This is something that I tell my students. If you're going to use a resource for any of your work, be it a paper, be it a care plan, whatever it is, stay away from .coms, okay? And sometimes people bring evidence from .com websites. Anybody can put a website together and post things, right? So the resources that come from .gov, .org, or .edu. These are all evidence-based. These are a collection of, for lack of a better word, peer-based studies and evidence. So if you're curious about whatever is going on with you and you're researching that, be careful where the information is also coming from. And don't use that to challenge a doctor or any provider at all, nurse practitioner, PA, it doesn't matter, right? When you challenge somebody, we're all humans. There's either a need to be defensive or kind of like, okay, can that hold on for now, right? And that's where people usually miss. It's like, well, I'm just bringing this information to you. How did you say it to me? How did you bring it to me? Most medical providers are very open to having a well-informed patient, right? Because we're in this together, right? You're in the driver's seat. Let me know how this is working out for you. A patient-directed or patient-centered treatment is all what we want. We want you to be well aware. However, be careful where you get your information from. And also, not everybody has the same genetic makeup as you do. Not everybody has the same metabolic makeup as you do. So the study or whatever you could have gotten from the internet that talked about somebody of a different race, nationality, genetic makeup than you are may not necessarily apply to you. You can bring it and have it be a discussion as opposed to being a challenge. I guess that's what I would say to that. And what do you think?
Absolutely. When people raise those questions to me, I will also say, go to trusted sources for your information. So the trusted sources, the large academic medical centers have a lot of really good clinical information. There's also the federal government. The National Institute of Health has very good information on it. So there are sources that are doing the latest in care delivery and in clinical trials. And those are the sources that can help identify, what you need to know about your condition or how different conditions relate to one another. And then the other area is really the peer communities. If you have, cancer or diabetes or any, in my case, there's a myeloproliferative disease foundation that has a lot of peer-related resources. And so you can always go on these websites to see what you can learn from other patients who have gone through the same exact thing that you've gone through, and also talk to researchers who are spending their life's work in the area that's an issue for you. And for me, the hematologist oncologist, and I really over the past 20 years have seen the landscape of the doctors and researchers who do this work. And I am just blown away by their dedication and the advancements they have made in the last 20 years. It's been just incredible and heartwarming, and just, I feel so fortunate that I know I have really a reliable, trusted physicians to get information from. And so depending on, the complexity of one's disease, I think it's important to, like you said, to make sure you focus on those trusted sources.
Absolutely. And the one thing that I would like to ask, do you think in your searching for, say, organizational tools, a hub where all your providers are kind of like located, appointments, specialties, and also researching the disease process, right? Do you think if there was such a tool that everything was under one umbrella where you can have a snapshot of your appointments and your doctors and the different specialty, and a snapshot of, sample questions to basically ask on your next appointment based on, say, your last lab, okay, the last lab values, or the last, say, visit notes from your provider. If there was a tool that can take that information and give you like a snapshot of potential questions to ask for clarity. And of course, maybe you can clean that up if you're already aware, or direct you to these reputable sources that we're discussing to basically see what advancement there are in the field of healthcare pertaining to whatever you were going through. Do you think that a tool like that would have been useful, or would be useful for the future patients?
Well, the current state of information is that it's all over the place.
It is.
So it's up to each patient to find those trusted sources of information and perhaps consult, if it's a disease that's new to you and it's very serious, to get a second opinion. And also, as I said, peer communities, but also disease-specific communities. So the disease-specific communities will give you the most information and background on the disease, clinical trials that are happening, and like you said, and hubs of medical and hospital services that help support people who have those diseases.
Mm-hmm.
But it's really up to each person to figure that out and put all that information together.
Right.
And I always say, do it to the best of your abilities, but ask for help if you need help. So in my program at the large academic medical center that I have been going to for probably the past 10 years, they have a social work department, they have a pharmacy department, they have a nutrition department, and I have gotten support from all of those areas. And the doctor is the one, makes the referrals. There's a pain management center. There's a whole separate area that prepped me for the 5-week hospitalization. So the larger places for the more complex diseases will have pretty organized systems that you can just tap into and make best use of.
Yes.
But if you're not going to go and make that, so some places will make appointments for you, but if they don't, you have to do that, and you have to follow up, and you let your doctor know if you're having trouble, to always ask for help. So as I said, even though I had a whole career in healthcare administration, I fell so short as a patient because I never wanted to be a patient. Nobody wants to be a patient. But you know what the truth is? We are all patients. And that's part of a slogan that I use. We are all patients. Because from the moment that you are born to the moment that you die, you need care, attention, monitoring, preventive health. You need to insert yourself and be able to be a smart user of the healthcare system. Again, as much time as you spend buying a house, buying a car, learning a new recipe, this is the detail of your life that's so important. So that's part of my answer. The other part is that understand the patient portal system that your healthcare system may provide. I think the trend is mainly that a lot of physician practices come under the organizational structure of the hospital and all the hospital's components. So physician practices, whether they're faculty practices, whether they're clinics, or how all they're organized, most of them use the same system, the same like patient portal. You can find your records. But in my case, I live in a suburb, but I go into a city to get my care. But all the other care, primary care, GYN care, dermatology, all the regular maintenance stuff, I get closer to my home in the suburbs. And that system is a totally different system. So I have two systems, go to two health systems with different electronic medical record systems. And in that case, I'm the hub and I have to share information across the lines all the time. And that's where also the whole point about writing things down comes in, and that I have everything in all one place. Because when I'm seeing one doctor, I will share information to the next doctor and the next doctor and the next doctor. And I will have to download or make copies if it's the two different systems that I have to go to. And I'm hoping in the future that will change, not for just my particular issue, but that these are all the systems connect with one another. So it's easy for patients and their doctors to have access to the whole picture. The other thing, as we get older, 10 years is like nothing in terms of a health history. And medical record systems, they don't have to keep records that are more than 10 years old.
Yeah.
And I ran into that a few years ago. And I mean, it is what it is. So the baseline becomes something different. The baseline becomes 10 years ago and not 20 years ago. And when you're a woman who had children over 30 years ago, well, what happened 30 years ago when I had children? Did I still have these same issues? Well, won't really know because the records aren't available. But I think, every patient should well understand the patient portals that they have access to and what information. And some will, keep record of their appointments and there'll be reminders set up. But not all information that's discussed at a physician appointment gets put in the portal. So you're having this discussion with the doctor, doctor's asking you your questions. The doctor doesn't put in the portal, patient asked these 4 really good questions, and this is how I responded, and this is the follow-up. No, you have to keep these records.
True.
I'm glad this resonates with you as really,
It's true.
the provider.
It's true. Because again, everything is pretty much set to parameters, right? It's the red flag is stuff that you will find in the chart, in your EMR, right? Your electronic medical record. So if there was nothing to trigger the mental health stuff, and it was a run-in-the-mill question about whatever it was, it may not make it in. Are you stable? Was your last lab results discussed? Did you have any questions on that? The recommendation, referral, those are the kinds of things I'm making to help your office visit notes, we call them, right? So yeah, the conversations do not always get in there because, the back end of stuff these are things that the everyday patient doesn't think about and they shouldn't worry about, right? So the quality metrics for the hospitals, right? These are set standards that hospitals have to follow. And the set standards are what needs to be in your note, right? To consider it complete. The conversation may not check that box. So you keep your conversation, you write things down, you remind your doctor on the next appointment, this is what we discussed last time. These are the things that I did, to change my lifestyle. I stopped smoking a pack a day. I'm down to half a pack a day. Things like that will make it into your medical records. However, having conversations, the general stuff doesn't usually make it. So that's a great point. That's a really great point. Keep records, write it down. Even if you don't see in your office visit notes, However, it is your responsibility to keep that conversation going so that it helps in one of two ways. It helps the doctor understand what kind of patient you are. Are you following recommendation? And also it helps you. It shows you as a serious patient, somebody who's involved in their care. So yeah, that was so good. That was so good. Yeah, write those things down. So you said something that tickled me really in the beginning before we started recording. You called yourself what kind of a patient?
Professional patient.
Professional patient. So what is the picture of a professional patient?
So, because I spend so much of my time now, and it must be that it's in my blood, which is sort of ironic, it's in my blood. So, being in healthcare, there's something that really draws me. And again, it's like I'm not clinically oriented at all, but I really care about people taking care of their health. And so, what I have shifted to, not being able, because of my recovery process, and I'm about 5 years post my stem cell transplant, and I am doing so much better this past year. I've really come into myself and back to myself. And, before that, I started, as I said, I started researching, but I had to figure out, okay, what do I want to do with all this knowledge? And what do I do with my time now that I'm not going to return really to a full-time healthcare management position? That I really do find it fascinating to understand strategies and the communication skills needed to be a patient and be really optimize one's care. And how do we be really engaged in our care and engaged in our health so we're as healthy as we could be? And so, here I am, theoretically, one could say I could just retire, but this stuff has just been really grabbing me because, a lot of my time is spent on my own recovery and feeling better and getting good responses from doctors about how I approach my own health and the conversations I have about my health, and just putting in so much time as a patient and understanding what it is to be an engaged patient, that I came up with the concept that I am a professional patient. So I think that's putting the little bow on that. I say it with a little smile that I'm a professional patient, but obviously I want to be taken very seriously as someone who understands patient-physician communication and can do well in this, will continue to contribute to the conversation.
I love it. Absolutely. I love it. That's really stuck out. So let's talk about a little bit of the intersectionalism of, working in healthcare and now being a patient who receives a lot of care in that system. What have you learned when it comes to being an administration in healthcare and understanding a patient's perspective? What is that intersectionalism for you? What has that been like?
Well, wanting my desire to understand it more and what those connections are has actually led me to two opportunities to do what I think important sort of volunteer advisory work. And one of them has been the Journal of Patient Experience. It's a professional journal that doctors, researchers, and patients can contribute to. It's an open access journal. And I was accepted to be a board reviewer of the articles that come in. And so I get to use both my knowledge of how the healthcare system works against what it means to be a patient in that system. So that's one example of what brings those two things together. The second volunteer opportunity, I've been doing this for about a year and a half, is that there is an organization that's funded by federal money that oversees all the clinical trials for bone marrow transplantation. It's called the Bone Marrow Transplant Clinical Trials Network, and it represents all the clinical trials that are conducted by about 130 or so hospitals across the country. And I'm on a patient and caregiver subcommittee of this organization. And this subcommittee, I'm one of about 4 patient representatives. I am not the only one that's been in the healthcare field, but other people have done like adjacent kind of work or social service work, or they were a caregiver. So people come with similar kind of knowledge, but it's about understanding how can we expand access to people to have them know and identify clinical trials that may be appropriate to them. At one side, and then the other side is these researchers who come up with, hypotheses about how to use drugs to make the bone marrow transplant process more successful and less risk for people. I mean, that's certainly been amazing for me to be, part of that group to watch what goes on, but then to help translate that to patients and their families to broaden their knowledge of what goes on. So I would say generally, my background and being a patient allows me to participate in these ways, and also, talking to different groups and talking to healthcare groups or talking to employer groups who are looking to improve the healthcare of their employees or the healthcare of the community, or people who come to my programs also are there as caregivers, and they want to do a better job because there's so many things they don't understand. So I think coming from it, having the background of really understanding how a system works and what options are for people, and then what goes on, and I don't know if you cover this in any of your nursing courses, but the root of the word patient is suffering.
Mm.
That's the Latin or Greek root of the word is suffering.
Right.
So coming to it from both perspectives, I think just gives me and I'm not the only healthcare professional. There are a lot of doctors like on LinkedIn and TikTok who have gone through their own medical crises, and they talk about it, and they talk about it from both perspectives. And the more that people talk about it from both perspectives, the more I think information there's available for people to not just understand, but say, oh, that's an idea.
Yes.
That's a good idea. Let me try that. So a lot of the ideas for resources came from when I was going through my disease, my first identification of my disease, I would find out from other patients who have gone through similar things, and it was really helpful. And it also in terms of emotional support, other patients can really help, just like give you those few words that help just push you to keep going. And I think that's really important. And, I'm one for, I guess I have a lot of more optimistic leanings, and I'm not courageous on everything, but I find when it's a little bit of courage and a little bit of courage and a little bit of courage just helps you build that strength to be able to fight through when bad things happen. Even when maybe I had 5 emergency room visits in the past 5 years, and every time something happens, I just have to grit my teeth and hope that, I'll be okay and get through it. But knowing what to expect, or knowing how strong I could be, and knowing I have question asking skills. So we didn't talk about that subject, but this is an important thing I want to say about question asking skills. Some people will say, oh yeah, no, I ask good questions. And other people will say, I don't know, I could never think of the questions that I want to ask. Mm-hmm. Well, asking questions is a way for not only for the doctor to get to know you, but for the doctor to know what you don't know. So if you ask this question, but you're not asking it quite right, the doctor will know that you really don't understand, and the doctor will give you information. And if you don't ask a question, the doctor will think you already know the answer to the question.
Ask. It's not a test, it's not a quiz, it's not a competition. Ask the question. Does not matter how you say it or if you know the right terminology, ask. If it is a time to correct you, that's the only way we know to correct you, if you ask, right? And, talking about, when it comes to clinical trials and testing and things like that, there's certain communities that are marginalized, and we know the disparities in healthcare exist because of, history, right? So with these organizations that you're part of, what body of work are they dedicating to the communities that are marginalized or suffer disparity in healthcare? So I'm going to talk about the African American community, for instance. There's so many experiments that was inhumane. The example, the Tuskegee Airmen syphilis experiment, and that has really caused a lot of African American, patient or a patient population to not trust clinical trials or even go that route in seeking treatment, right? So what are organizations such as the ones that you do volunteer for and also give your opinion on doing to kind of like eliminate that distrust that has existed and can actually work to save lives?
Wonderful question. And the bone marrow transplant clinical trials network that I'm a part of is funding through some private sources, actually, probably pharmaceutical companies, a whole study on how to expand access to marginalized populations.
Beautiful.
And I volunteer to be part of that group
Beautiful.
as well. But this is ongoing. I mean, it's a focus. It's part of every conversation that they have. And I mean, the fact that this group actually came up with the protocols and the trials and the result finding that African Americans who have sickle cell disease, who could benefit from a stem cell transplant, can get their bone marrow from a sibling using these medications, and the success rate will be so much greater. And this was, in the news. This is like medical advancement news. This is just like could make you cry that this is the group that I'm part of. I mean, I feel so fortunate to even be like a witness to this. And they have been working on this for a while. And I think because of that, and because they have been working on other related things, they just decided to do a whole project just focused on access. So a lot of it has to do with how do we communicate with patient populations who aren't comfortable,
yes,
right, with participating in a clinical trial.
Right.
And one of the things they're working on really is a whole shift in an educational campaign.
Absolutely.
And making the information more accessible, whether it's, more videos and spoken in different languages, whether it's sort of an animated series on how you can understand blood cancers. However, they're doing a whole list of things to be able to test out, will this make a difference in terms of people, identifying this as an opportunity for them to improve their lives.
Yeah.
And certainly anyone who participates in a clinical trial, it's about improving the lives of future populations.
That's great.
When I was rejecting that I wanted a stem cell transplant, I did participate in 2 different clinical trials thinking, and I did my research, and I thought that, that it was low risk for me to participate. And it was who knew if it could help or not help. It turned out 2 clinical trials didn't help me, but clinical trials help future populations. So they're so important. And I feel really good that I was able to, be able to contribute to that as well.
That's beautiful to hear. And this is the one thing that I see healthcare organizations do that does not really yield a lot of the result that they want to yield, is that they go at it alone. If you want my people to listen to you, they've not been listening to you. Use somebody that is trusted. There are a lot of non-for-profits that are in the sickle cell arena. I am one of those that champion the sickle cell stem cell transplant, because I have a personal experience, right? So I, from my healthcare background and knowledge, educated myself enough to know that the stem cell from umbilical cord blood can also be used for that transplant. So what have I done? Of my two children, their cord blood is banked, right? So how many people do know that in the community that is most affected, right? Not a lot. So how about you sponsor those initiatives to those people that are actually educating the community? There's several of us, there's a lot of us, right? So people that are actually trusted in their communities, who are advocating and doing things for the community, seek those people out and also bring your message into the forefront. You and I are talking today, right? We've come to this side of the conversation. It wasn't what was planned. This is why I love this conversation to go the way that they do go, right? It is great to have that. This is a study that was on the news. What part of the news? I've not been aware of that. So where is this being published, right? What providers are we making sure that we're connecting with? So the patient populations that this actually serves can be aware of this, right? So I can go in the forest and scream for somebody in, New York City to remotely hear me, because that's who I'm trying to communicate with. Does that make my communication effective? It doesn't. Right? So we have all this advancement, we have all these things, and we have money set aside for this. We're doing all these initiatives to benefit certain communities. However, we are not communicating with our community directly, right? So if I could offer any kind of like directives or advice or tips or whatever it is that if these advancements are actually in place, and pharmaceutical company, healthcare systems, whoever you are, you want to make that difference, and you've done the study and you really want to help the people you want to help, work with the people that are connected to the people you want to help. It just makes sense.
Yes.
Okay.
Yes, absolutely. Absolutely.
It just makes sense. It's exciting to hear about it because, advocating and providing education, which is the core of, my business that I started, and why I have these conversations on this podcast, to build these communities, to connect people to who they need to connect to. I'm very conscious on, the people that I talk to. I'm very conscious on, the information that we're discussing and asking certain questions, because if I know the questions to ask, I know not all the patients I meet and interact with know what questions to ask. And you can attest to that, So it is very important that you ask the right questions. We are in the computer age, we're advancing. And the plan and the goal is to have something that can kind of connect everybody. Not every hospital system can have, the bells and whistles as, Epic, the system. Some are smaller than others, but while we are working towards that, it is important to know that if you have anything out there that can help connect people more, let us know so people can utilize that, because communication is very important.
So I wanted to, I guess, point out a few things that you referred to. One is that there's a thing called question prompts, and question prompts have been studied by health services researchers for 40, 50 years. And I think what's interesting is that they started with, let's try these 25 question prompts that are applicable to any disease. What's my diagnosis, and what should I, and what medications, and what are the risks, and what are the benefits? So 22 questions, and they experimented with that, and they saw there was an improvement in patient engagement because the patients had these questions that prompted them to ask the questions, question prompts. And then they studied it, and they say, okay, well, we don't need all 25. I think 12 will be okay. So then they studied it with 12, and guess what? They came down to 3 questions, and I'm going to read you. So they basically boiled it all down. There are 3 questions, and I make that available, in my in the workshops that I do. So the first question is, what are my options, including wait and see? 2, what are the possible benefits and harms of those options?
Oh.
And 3, how likely are each of these benefit and harms to happen to me, including what will happen if I do nothing? So if you have no questions to ask, these are the 3 questions that you should be asking. But also, question prompts specific to your disease. As I said, those disease-specific websites will give you all the questions. I think you alluded to it. So that's why I say the preparation stage is so important. Go on to a couple of those websites and look and make notes or print them out. And here you have your ready-made questions. So somebody says, I never know what to ask. I think of my questions after I leave the appointment. That's why I'm saying prepare in advance, write the questions down. Sometimes when they're, some of my friends have said that they have their own questions and follow-ups, that they'll type that up and they'll give a copy to the doctor when they walk in the room, say, oh, these are the questions on my mind. Can we see if we can get to most of them? I have sort of tried that. It doesn't work for me that well. And it's not for me. It's like some doctors want to take the lead in, okay, let's just go over what happened. They go through the record, they go through their memory, and they want to do things in the order to make sure they get everything done. Like you also had said, they have certain things they need to check off to do, like, going through, I have like 15 medications, going through each and every medication and the dosage and everything. All right. So that's what I wanted to say about questions. I also think it's really important for people to have like the language of their disease. People say, oh, that's too hard of a word to pronounce, or I don't know what that does. Well, this is your life. This is your health. Spend some time looking at it, reading it. You could put it into Google or whatever, and you press that little sound button and it tells you how to pronounce the word. When people say, I don't know how to pronounce that word, if there's one thing that irks me, that irks me. But you have to prepare in advance, right? And also you have to understand the importance of how these details are important details in your life. Okay, so the medication and understanding your medications, and if you don't get, some people have said to me, well, wouldn't it have been up to the doctor to tell me, they see I'm taking this medication and what how come they didn't mention anything? My pharmacist had to mention it. So next time you go to the doctor, you say, oh, by the way, I just wanted to share with you that the pharmacist told me that, what do you think about it? So it's always like this accumulated knowledge keeps building. And when you keep testing it out, so the next doctor you go to and you say, oh, yes, I added this medication. What do you think? Any other drugs interact with that? And like in my case, in my department, the hematology oncology, they have like a pharmacist just assigned to that department. And that pharmacist will come in and go over all the meds and understanding. And, there's so much to know about your meds. If you take, more than 3 meds, and I take 15 and I take them at certain times of day, and I have to remember either to eat or to not eat, or what drugs could be taken together, or what needs to be refrigerated and what doesn't. And there's one new cardiac drug I have to take every other week to give myself an injection. And I thought I was so good at having everything organized, and I put it in my calendar. But you know what? I missed putting into my calendar, and I missed a week. So things happen.
It does happen.
Things are bound to happen. But you don't have to be perfect. It's not about being perfect. It's about like caring about your own health. It's about caring and wanting to know. So that's why I say the language of your health, I think, is very important. And then also we have talked about this throughout our whole conversation about when you're in the room with the doctor and it's the participation, you want to be able to react and interact. You need to, give your full focus. And some people have suggested if you feel like you have trouble, like being able to pull it all together, to maybe ask for somebody to come with you, a family member or friend, or ask the doctor if it's okay to record the conversation. So if it's that important to you, you can review it. But I think it's like being in the moment and listening. So it's like being free your head by all that preparation. So free all this stuff running through your mind. So you could be in that moment to listen to what the doctor is telling you. And if you listen and repeat it back to yourself and then write it down. And, my notes are all scribbled. It doesn't have to be perfect. But I want to remember, but the doctor said this in particular, look out for this. Or maybe we need to look at it next visit. I want to look at this again. Or the doctor said to me, you don't need another bone marrow biopsy right now, but like in 2 months, maybe we'll do another one. So I wrote that in my notes. 2 months go by, going through the appointment. I'm giving her the benefit of the doubt. And I'm saying, oh, doctor, didn't you say that in 2 months you wanted to do another bone marrow biopsy? So she thinks I'm a very good patient. So because I want to live.
You don't want to live, and you're you. So a doctor, typically a doctor sees between 20 to 30 people a day, right? So about 20 to 30, depending on how busy the practice is, I would have to say, right? Imagine those people cycling through in a 12-hour day, and then, or an 8-hour day, doesn't matter. Then the next day, then the next day. So 2 months on end, she may not remember what she said to you, especially if it was not in your chart. Because what most doctors do is that they review your record before they come into that room, because it reminds them where they left off from the last visit. So if that wasn't in that note, the doctor's not going to remember. So it is your responsibility to remember. And when it comes to pharmaceutical, yes, those names can be daunting, right? The generic names are, so that's why we have some brand names of a drug. I had in a clinical last week, one of my students, what we do is that we review the medication. The students has to tell me, okay, so this is why this medication is commonly prescribed for this. This is why I'm giving it to the patient, because yada, yada, yada. I want them to understand why they're giving the medicine. So the man, understanding what was going on, so he decided to ask the student, what drug is that, and why are you giving it to me, right? And this is one of my best students. I saw him fall apart trying to pronounce the generic name to the patient. So I let him be. We already went through it. So when he finished, I just pointed to the brand name. I said, you could have said this. And when I said that, the person's like, yeah, you could have said that. I know, I take that for this. This is why it was prescribed. This is how it looks. This is a shape. I said, see? So sometimes it's easier to, when you're dealing with a doctor or nurse, right? If there's a common name for the medicine, just ask it, right? Ask it. And sometimes we have a generic name that other brands make and they have different names. Just ask. And, be somebody that is educated enough that even if I come in with a medicine from a different maker and is shaped a different way, there's something telling about it. And this young man also said the same thing. It's like, I have gone through 3 companies producing this medicine. However, there's something that stands out. It smells awful. And it all smells the same way. So that is something that you can, become an educated professional patient in knowing your stuff. I cannot deceive you. I cannot give you the wrong medicine if you know what you're taking. So that was incredible. That was really good. I really like it. So we could talk all day. I love this conversation, and I have a feeling that we may continue this conversation based on how many people really appreciate this and can use this. So in closing, what would you say to the, I don't want to use average, what would you say to the everyday healthcare recipient, right? A patient, somebody that finds themselves either managing a chronic condition, managing a genetic condition, or just, going to maintain their health. What would you tell anybody listening in that capacity?
That it is a difficult process for everyone, but when you find certain strategies or certain understandings of what you need to do, and you do a little bit every day to take care of yourself or to learn about the illness, the diagnosis, the drug, whatever it is, it all builds up, and it also gives you like the confidence and the motivation to continue. So there are things that you do that might seem so little, but it all adds up to that confidence and motivation. And it's also about being curious about yourself. You could be curious about hobbies or the things or your professional work or whatever it is, but be curious about yourself too. And don't be afraid to share yourself with your doctor, because it's all part of taking care of yourself. And using these pathways helps relieve a lot of the sort of anxiousness about what's going to happen in your future. You just want to do the best that you can to the best of your ability each and every day of your life.
Beautiful. Thank you so much. I love that. And if you feel like you need support in your community, be it a family member or a friend, if you feel you're too anxious at that time to listen to everything and ask all the questions, it's okay to go with somebody. I do know that the community-based healthcare advocates that do go on appointments with people in need, either they pay for it directly or through the insurance. And also for any insurance decision maker watching this, it is okay to have that additional service of a nurse, a social worker, case manager to accompany people to the appointment so that they can understand everything that is going on, especially with the chronic diseases or, acute diseases that require a lot of management. So be in the driver's seat of your care. Nobody else knows your body than you do. Your doctor depends on you to tell them whatever is going on with whatever your treatment, how you're responding to the treatment, how you feel. Please, please, please communicate. And thank you everybody for listening. Let us know what you think. Interact with this, podcast. If you have a similar story, we'd like to hear from you. We'd like to come back on and talk about this because this is ever evolving, that things are always coming out, that different advances in medicine that we'd like to share with everybody. So please, please, please do follow. Also, in the show note, this particular show note, we will include everything that you need to know about Dana in the show note. So you can follow her on LinkedIn, whatever social media platform she's on, also her business. And if you need to consult with her, we will have all of that information. She is a wealth of knowledge. She has experience in healthcare, and she's a recipient in that same healthcare system. So I really, really appreciate all of you. Thank you so much for being here. This was great.
Wonderful.
Thank
so
you.
Great talking to you.
Same here. All right. Bye, everybody.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.